Well, I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Baldwin University, and I wanted to go over elevated blood lead levels linked to suicidal ideation in adults. Let's go ahead and get started. So you can tell by the title that I'm going to be talking about not only blood lead levels, but how this may have an effect on suicidal ideation. Well, let's see what we find. I have no conflicts of interest disclosed. Um, so just an introduction, lead exposure later in life has been associated with chronic disease already, and also adverse mental health outcomes, but I precisely wanted to see how this association is. This actually is trying to show if there's an association with mental health and suicidal ideation. So occupational hazards are the predominant cause for increased lead levels in adults. A person's health status and life expectancy are affected by numerous factors, including genetics, personal diet, and exercise habits, environmental influences, disease, and socioeconomic status. So it's important here to note that there's lead actually decreases life expectancy. It also affects genetics. It affects the habits of personal exercise, personal diet, environmental. So there's a lot of association. So each of these factors can then exacerbate the impact of lead on a person's person's health status and life expectancy. So if we look at the methods, which is oftentimes good to look at, the age group we were targeting was greater than or equal to 20 years of age, and these are between the years 2005 to 2010 National Health and Nutrition Examination Survey results, looking for results. And participants had completed a medical exam and home interview and had results for concentrations of lead in blood and urinary lead levels, specifically urinary actually, and other relevant covariates. So urinary lead levels were considered elevated at greater than or equal to 1.9 micrograms per deciliter. So the complex samples logistic regression, what did it find? Well, what did we find? It was used to assess if gender influenced the relationship between elevated lead levels and suicidal ideation. So when we go over to the next slide, we see that the percentage with elevated lead levels was higher among males than females. The overall unadjusted odds ratio of increased lead was 1.43. Confidence level, of course, 0.91, 2.23. So it wasn't significant, but there still was an increase of suicidal ideation in this. So adjusted odds ratio was elevated at 2.42 among male participants, which was different from female participants who only had 1.56 after increase. So 56% increase versus 142% increase. So this is among 142% increases among male participants versus female participants. It doesn't seem to affect as much. And this was controlled for medical confounding variables like hypertension, stroke, obesity, and diabetes, and demographic variables such as age and poverty income ratio. So in the next slide, we go over some discussion in a nationally representative setting. Elevated lead levels were found to be significantly associated with suicidal ideation, even after controlling for poverty levels. So this actually was much stronger in males, even though there was a increase in females as well, but in males it was stronger. So complex biosocial interactions must be examined in order to understand how toxins such as lead affect mental health. I want to end with this. My contact information is there, and then some of the smelting processes from gold actually produces a lot of lead as fumes, and occupational hazard, talk about that. This is a place for occupational hazards of lead. Wanted to also show you a lead battery. These are lead acid batteries and actually invented during the 1800s. So It seems like it's needing a revamp, but unfortunately, these are full of acid and still used to this day. I hope this has given you some insight as to how this is, and thanks to all in public health who made this possible. And of course, this was again the 33rd International Congress on Occupational Health. Thank you for listening.